I talk about this all the time on live, but I realized last night when I was looking through my analytics that I don't have a video addressing NCLEX prep. I get a lot of people that ask me, what do I study for NCLEX prep? What do I study for NCLEX prep? After they've already completed the program. If your program uses UWorld or ATI, Saunders, I think HESI is one of them too, I think. Prep U, all of these different programs for NCLEX prep. You have already paid for those programs. They have already incorporated those assignments and the style of that book or that material or that program into your program. It already accounts for 20 or 30 or 40% of your grade depending on your school. Why are y'all outsourcing for NCLEX prep? That is familiar. I talk about this all the time. I talk about sequence, familiarity. I talk about those type of things all the time. It's very, very, very important for you to have that familiarity. You already know how that program is designed. You already know how that program works. You know how when you answer your questions, you get your answers. It gives you the rationales, and it'll also tell you what area that was in. You get to score to see what area you are weak in. Now, a lot of people say they go on ChatGPT and they make question banks and stuff. That's cool. I'm not gonna tell y'all to do that. That's not what I'm on. I'm not gonna tell y'all to do that. I mean, that's cool. It's gonna spit you some answers out. It's gonna spit you some rationales out, but it's not gonna teach you how to think. It's not going to tell you what lens you need to look through when you're reading these questions, when you're reading the scenario. It's not going to teach you how to think through the question. It's going to give you an answer, give you a rationale, and you back to square one. It is important that y'all learn how to utilize those materials that they give you. You already paid for them, but it's important that you learn how to use them. Y'all just using them. Anything you get in nursing school, you have to learn to use it to your advantage. If you've been following me long enough, y'all know how I feel about ATI. I hated ATI when I first got it. It was overwhelming. I can remember the first day. I never cried in nursing school, but the day that I opened up that ATI stuff, I'm a girly that love new stuff. So we got this book and it's wrapped in plastic. I couldn't wait to open it like it was a gift. Opens up these books and I immediately got overwhelmed. It was just too much damn information. And it didn't hold my hand. It was to the point. This, and this. There's no, I use the word fluff since y'all like ChatGPT so much. It's no fluff. It's just straight to the point. So if you don't know it, you can read it and still won't know it. That's why I tell y'all the importance of translating academic phrase to things you can assess. Like when you read stuff like decreased cardiac output, urinary retention, and all the things. It's not going to say that on the exam. You have to break that down, send you an arrow out to the side of you writing notes and write down what that looks like clinically. ATI was the best thing that ever happened to me. Because once I embraced it, I got to do it. It's on my syllabus that it counts for this amount of my grade. If I fail ATI, I fail the course. I embraced ATI, and I'm not endorsing ATI. I don't get bread or nothing for this. I'm telling you that if you use Saunders or whoever that you use, you need to use it to your advantage. I used it the way that it was I was taught to use it. And then I also went a step further to go and see if it's prioritization or intervention or education or delegation that I'm weak in. And I strengthened those areas. When I took my exit exam, I scored in the high 90s. That's going to let them know the probability of you passing NCLEX on the first try. Y'all have got to embrace these programs. Stop outsourcing y'all thinking. That's what y'all do. Y'all outsource y'all thinking too much. You always looking for somebody else or something else. Y'all reading too much. You need to go deep with what you got. I talk about this all the time. Y'all love going wide. You go too wide. You reading this, read this because you're not processing it. You reading it so it can be read or said in a way that you can remember it. You still studying, trying to memorize what you read or what you hear. You will not be, your nervous system will forever be dysregulated if you're trying to remember 2 years worth of diseases and disease processes and the other things that you learn in nursing. You're going to struggle. I know I get on here and I talk about these things, but I be dead ass. Y'all got to get y'all head in the game. If you feel like, a lot of y'all say, I feel like I'm teaching myself. You might be. Because the instructor is going to teach at the level of expectation. They expect that you know normal function. They expect that you know abnormal function of the organs. All they doing is adding an additional layer in med-surg by giving you scenarios with patient presentations and want to know what you going to do about it. What is the body failing to do? What is the immediate threat? Which action should the nurse take first? That's what they own. They not scaling back to see if you remember how something failed, the point of failure and all the things. That's not what they do. I do that. They don't do that. I'm just trying to help somebody. Y'all are still on the surface and y'all still wide. I'm letting y'all know now. Especially since, because I pulled some stuff off and I'm going to do some content based on that. But I got the entire study plan for RN and LPN NCLEX. I got the entire study plan, what's going to be on the test and all the things. So I said I was going to teach y'all what lenses to look through for these different exam questions. But you should be studying for NCLEX the day you get there. The day you get to nursing school, you should be studying for NCLEX. You should be studying in a way that's consistent with you passing the NCLEX test. You need to sit down at all your nursing exams and take those exams in a fashion that's consistent when you sitting for state board. You do not wait until nursing school is over to study for the NCLEX. That's what y'all doing. Y'all not thinking about NCLEX. You're not studying none of that while you in school. I know this video long, but I got to get this out. Y'all not studying for NCLEX when you get in school. You're not doing that. You just going through the motions, trying to survive nursing school, and then at the end you want to take this cumulative approach to try to study everything that you study in nursing school from the first day. It's not gonna happen like that. That is the importance of studying by failure pattern. I talk about that all the time. I'm not trying to sell y'all nothing. If you buy my course for med-surg, you investing in your future. This study system is coming up off TikTok one day. This is a control group, a study group to get my social proof to prove to y'all that what I'm telling you works. It's not going to be on TikTok forever. You know what I'm saying? Because I'm trying to get this off in the schoolhouses, in the college houses and stuff. What I'm trying to tell you is if you study by failure pattern, you can group those diseases together and learn how the body fails. That's what nurses do. We chase failures. We do not chase diseases. We chase failures. We stabilize threats. We stabilize body failures, physiologic failure. That's what we do. You go in there every time you study and you're trying to study disease process after disease process and not knowing the similarities between them or the shared patient presentations, how they would be shared patient presentations, meaning that anybody that's dealing with gas exchange or fluid overload or fluid loss will present in this way. The first nursing actions for all diseases that fall under gas exchange failure or fluid overload or fluid loss, they all will have the first nursing actions. It's your responsibility to know the signs and symptoms and individual things that makes those diseases unique and know what to do for those. This video getting ready to end. I meant to be on here like 3 minutes. I'm sorry, this video getting ready to end. I'm running out of time, but I'm NCLEX, your clinical competence coach. I do not do tutoring. I do not do one-on-one. I do have a course. All of that stuff is coming. I got too much on my plate. I can't do all that right now. But I do want you to be successful. My name is NCLEX. I'm your clinical competence coach. I'll see y'all in the next video.